what is an irregular period, and why is it caused? Like, what are the basic causes behind it?
See, basically, the most important cause of an irregular cycle is a hormonal imbalance. You have two major hormones, female hormones in the body. One is estrogen and one is progesterone. So, if there is a imbalance in these two hormones, which is basically by the imbalance between the other two hormones which are there when they prepare you, FSH and LH. So if there is irregularity in the FSH and LH hormone, which will lead to an irregular proportion of estrogen and progesterone in your body, it will lead to an irregular cycles. So we have to assess which stage of menstrual cycle, or why your egg is not maturing at the right time. Suppose in cases of PCO, you have so many eggs in the body, but they don't mature at the right time. Right. Sometimes it may take 2 to 3 months for an egg to mature also. So that leads to an irregular cycle in these kind of conditions. So we have to understand what is the cause. If you have less eggs in the body, then also it takes a lot of time for the eggs, to mature, or it may sometimes mature prematurely. Not taking 14 days, but maybe in 8 or 9 days. Okay. So that is why you get irregular periods. If you mature at 9th or 10th day of the cycle, then you will have early periods. Okay. Right. And if your egg matures at 30 days or 40 days time, then you will get a period which is delayed like that. So this is how it goes about. So you have to assess when the egg is maturing.
Right. And for someone who is having a regular period, when the monthly, even the dates are correct according to their cycle, but suddenly they miss a period without having intercourse, so they know that they're not going to be pregnant. So that has a very stressful impact on a woman. That why am I missing my period? And they don't, and immediately they can of course they have to take time, they have to take an appointment to go to gynecologist and then check. So what causes that kind of a missing of a period?
Yes, the same which I explained just before this, that why you miss a period. The most common reason when a patient comes to us and says that I have missed my periods, the first question or the first will be think whether you are expecting to get pregnant or not. Despite the marital status or the stage, we go for a urine pregnancy test, which is the most basic test, supposingly, and it turns out to be negative. Then yes, we have to see, is there an ovulation which has happened in that cycle or not, or the uterine lining is good or not. Sometimes there are hormonal imbalances which lead to an anovulation, or there is no ovulation, or there is some other problem. Then also you will end up into amenorrhea, or what you called as missing of your periods. Or sometimes there is end organ damage also. Like your uterine lining gets damaged if you get repeated abortions done, or if you take, if you undergo some vigorous DNC procedures, then your uterine lining gets damaged. There is Asherman's, we call that Asherman's. So because of that, there is something which is not letting your periods to come out. So that is that is also one of the reasons for someone to not get pregnant. Right. Or there are other reasons, like you're feeding your baby. If you're feeding your baby, you're into lactational amenorrhea at that time. Right. Sometimes if there is torrential bleeding during post delivery, or we call that postpartum hemorrhage, then also it leads to in some of the cases it leads to amenorrhea, and we call that Sheehan syndrome also. So there are multiple causes. You have to first take the history, you have to analyze what is the reason, then only you can make a correct diagnosis of a missed period.
Okay. And a lot of women, even my friends also, a lot of, like, we talk about these things, and we find out that even stress a lot of time causes for us to miss our periods.
Exactly.
How are these two things related? Because stress is a very mental thing, periods are a very physical thing. So how does this work?
See, I would say stress is such a thing which causes a lot of changes in your body. Okay, your body has got multiple, it's a complex machinery,
right,
which has got multiple things into it. Your brain has got something to do. Your brain releases some hormones.
Right.
So stress basically affects your brain. When it affects your brain, there are certain hormones which are produced, which will ultimately lead to irregular cycles. Change of seasons can also lead to these kind of things. So this does happen, and we have to if you're not taking proper food, you must have seen some ladies, some girls who are very cachectic. They are very thin, lean built. They will have they will be having menstruation problems. Definitely. You must have seen females who have very heavy built females. So they also have these kind of problems. So this, because your fat also has something to do with your estrogen levels. So this ultimately, your physical, your body, your stress levels, your medical status, this all impacts your cycles, how it goes on.
Right. So it could be stress, it could be a change of season, it could be anything and everything
it
that
can.
impacts you in
Impacts.
some way or
Yes,
the
yes,
other.
yes. Because it is not just a menstruation, it has nothing to do only with your uterus.
Right.
It has to do with right from your brain, it has to work from there.
Right.
We call it HPO axis, hypothalamo pituitary ovarian axis. So that itself indicates that your hypothalamus, which is there in the brain, your pituitary, which is there in the brain, and your ovaries, they work in a fashion, they work in a synchronized way. So if you are stressed out, definitely your brain gets affected. There are certain hormones which get affected, and ultimately it may lead to irregular menstrual cycles or other things in the body.